Hello everyone, we are back with yet another episode of Illusion Training and Education. Today, let's talk about how to take a facebow record. We have all seen and heard about this instrument known as the facebow ever since we were studying dentistry. However, we tend to forget about it the moment we pass out of dental school because we are not really taught how to use it correctly. A lot of dentists believe that taking a facebow record is an extremely difficult process. However, I assure you, with the correct technique, taking a facebow record could be quite a straightforward procedure. The facebow basically helps us to record the spatial relationship of the maxilla to the TMJ and then transfer this relationship to an articulator. This becomes extremely critical when we are doing full mouth rehabilitation or aesthetic cases where we need to orient the incisal plane correctly. So let's have a closer look at the parts of a facebow. This is what we call the ear bow. You can see there are two ear rods which are placed into the patient's ears as the two posterior reference points. This is the screw which we need to tighten once the ear bow is fully seated into the patient's ear. This here is the anterior reference point indicator. This needs to point to the anterior reference point which we need to locate and mark. These are the two bite forks that you get with the facebow set. One of these is used with dentate patients, that is patients with teeth, and the other one here is used with a bite trim when you are treating an edentulous patient. This here is the most important part of the facebow. It is called a 3D joint or a universal joint. This will help us register the orientation of the facebow so that it can be transferred to the articulator. This is the transfer jig on which the 3D joint is attached, and this entire assembly sits into the articulator to facilitate the transfer of the facebow record. I have the bite fork ready here with some green stick in 3 different regions, that is 2 in the posterior and 1 in the anterior. I will now just temper the green stick with some hot water. I'll just keep the back of the fork on my gloved hand to ensure that it is not very hot. I will then go ahead and make the indentations of the teeth. It is important that the bite fork is exactly in the center. You can see that the line here on the bite fork is coinciding with the midline. Once it's done, I am going to keep it aside. The next step is to position the Uframe or the ear bow. Now I am going to loosen the screw to adjust the width of the Uframe according to the patient. I will place it into the patient's ear, and after confirming that it has gone into both the ears, I will lock the screw. Another thing we need to do is to check that the Uframe is parallel to the interpupillary line. I will get back the bite fork and position it onto the patient's upper teeth according to the indentations. I will also use some bundles of cotton rolls to help stabilize the bite fork. We need to make sure that the bite fork is stable and it should not move during the rest of the process. I am going to palpate in this region with my index finger. I will feel a depression below the orbit. I am going to mark that point with a marker. That's it. That's our anterior reference point. Now I am going to attach the 3D joint onto the ear bow at one end and the bite fork at the other. I will now open up the pointer, taking care that I do not hurt the patient's eye. I will then lock it into place. All I need to do now is to adjust the Uframe so that the pointer coincides with the anterior reference point. I will then go ahead and lock the Tommy screw on the 3D joint. It is really important to apply a good amount of force to tighten it. So that's it, our facebow transfer is now complete. Once this is done, I will unlock the screw on the ear bow and get the ear bow out of the patient's ear. Now I can remove the 3D joint from the facebow assembly by loosening the screw here. This 3D joint assembly will now be used in the lab to mount the maxillary cast. As you saw, taking a facebow record is not rocket science at all. All you need is regular practice. I hope this video has been helpful to you. Please write in your comments and questions on the email address flashing on your screen. Also, let us know if you want to see a particular procedure in the upcoming episodes. This is Dr. Mahesh Jagwani signing off until next week. Keep watching.